Assalamualaikum, I'm Laja Kamra Samindi. My topic, it's all about sarcoidosis. Learning objective number 8. Describe preventive measures appropriate for controlling and eliminating occupational lungs disease. So what is sarcoidosis? Sarcoidosis is a type of interstitial lungs disease. It's a multi-system granulomatous disease of unknown etiology. Although 20% of the patient demonstrate thoracic involvement, any organs may be affected. Sarcoidosis is usually present between 20 and 40 years of age and slightly more common in women than in men. So, sarcoidosis is an inflammatory disease that affects one or more organs but most commonly affect the lungs and the lymph glands. So, any organs can be affected dito sa sarcoidosis. Yung sarcoidosis is magpipresent siya sa 20 to 40 years of age and commonly, mas marami sa mga babae kaysa sa lalaki. Pathophysiology. Sarcoidosis is thought to be a hypersensitivity response to one or more exogenous agent, bacteria, fungi, chemicals, people with inherited acute predisposition to the disorders. So, pathophysiology of sarcoidosis. The cause of sarcoidosis remains unknown. Antigen triggers. So, the causes of sarcoidosis is remain unknown. Clinical manifestation. Hallmark of sarcoidosis are insidious onset, lack of prominent clinical signs or symptoms. The lungs is most commonly involved. Signs and symptoms will be affected dyspnea, cough, hemolysis, and congestion. Many people with sarcoidosis have no symptoms at all. Some people with sarcoidosis in their lungs call it pulmonary sarcoidosis. The lung is most commonly involved. So, signs and symptoms ng sarcoidosis. Yan yung mga rashes. Cough, dyspnea, and congestion. So, patients with the sarcoidosis have been found to have all increased risks of pulmonary embolism compared to the normal population. Pulmonary embolism is a blood clot in the lungs that occurs when a clot in another part of the body, went to the legs and arms, moves through the bloodstream and becomes in the blood vessels of the lungs. So, pulmonary embolism is a blood clot in the lungs. And prevention of recurrent pulmonary embolism. All completion of education, the patient and or caregiver will be able to do state the impact of pulmonary embolism on physiologists and state the changes lifestyle, diet, activity necessary to restore health, state the name of those side effects, frequency, and schedule for all medication. Describe the importance of follow-up appointments for coagulation tests and appointment with providers. And describe the signs and symptoms of pulmonary compromise related to recurrent pulmonary embolism: dyspnea, chest pain, anxiety, fever, cardia, and apprehension, cough. Describe how and when to contact the primary provider if symptoms is circulatory compromise or pulmonary compromise are identified, and identify the need of health promotion, disease prevention, and screening activities. So, assessment and diagnosis finding of sarcoidosis. Chest X-ray and CT scans are used to assess the pulmonary adenopathy and diagnose confirmed by biopsy that show non-causating granulomatous. So that is the diagnosis finding at chest X-ray, CT scans, biopsy. Biopsy. So medical management of sarcoidosis. Many patients undergo remission without a specific treatment. Corticosteroid may be beneficial because of their anti-inflammatory effect. Corticosteroid therapy is usually continued tipping doses for 12 months. So, corticosteroid yan yung corticosteroid are types of anti-inflammatory drugs. So, dito yung corticosteroid therapy ay tumatagal ng 12 months. And dito sa medical management, sa karamihan ng mga patient is nag-under remission without a specific treatment. And nursing management. Nursing intervention in the client with sarcoidosis is the same as the client with other restrictive lungs disease and hypoxemia. So, assess the drug side effects, especially adverse response to corticosteroid, such as weakening, change in mood, and development of diabetes mellitus. So, that's all for sarcoidosis. Thank you.